Good afternoon. Welcome to day 282 of the COVID fight here at the EMA office, where I'm joined with Chairman Kern and Director of the County Health Department, Barb. We have some numbers today, and it's a beautiful Sunday out there.
It is, and we have some beautiful numbers to share as well. Things are looking better. We're going in the right direction here. To date, we have tested 193,413 folks in St. Clair County. That's an increase of 1,716 since yesterday. And of those, we're reporting 114 positive cases. Again, we're going in the right direction. The cases are going down, and that makes our positivity rate 6.6% today in St. Clair County. Good job, everyone. So if we've had a total of 19,162 positive cases, 174,251 negative cases, but unfortunately we have 2 new deaths to add to the tally, making that a total of 297 deaths in St. Clair County. These 2 were both males, one in his 70s and one in his 80s, both with unknown health conditions. Again, our thoughts and prayers go to those families and friends of all of those 297 that have passed away to COVID-related illness in St. Clair County. We have 17,051 folks that have completed their 10-day isolation with through the IDPH requirements. Statewide, we have tested 12,434,525 folks. Of those, 900,370 have been positive, so that's an increase of 6,003. Unfortunately, the death rates still are climbing. We have a total deaths of 15,202. Within the last 24 hours, that's an increase of 75 that have died in the state of Illinois due to COVID-related illness. Hospitalization numbers in St. Clair County hospitals. We have 119 patients in the hospital with COVID-related illness, and of those, 13 are on ventilators. Region-wise, again, we're well over 209 patients hospitalized region-wise with COVID-related illness, and 20 are on ventilators. Again, our hospitals are being overwhelmed with all the illness and the IC units and the bed availability in all our hospitals. So again, we can't emphasize enough, even though our positivity rate is going down, we still have a lot of very sick people that are in the hospitals. So please continue to wear your mask and wash your hands and do the social distancing. As far as congregate care living, we have 2 additional cases to report at the 4 fountains with a total of 120 cases and 29 deaths. We have 10 additional cases at Mercy Rehab and Care Center in Swansea for a total of 83 cases and 0 deaths. And we have 1 additional case to report at St. Paul's Home for a total of 128 cases and 17 deaths. Again, we have several testing sites available. As we've announced before, St. Clair Mall is open 8 to 4, 7 days a week. They will be closed on Christmas Day. This Tuesday, we are having a drive-through clinic at our new St. Clair County Public Building Services site, which is at 330 West Main. And those testing for COVID testing will be from 10 to 12 and 1 to 3 this Tuesday, December 22nd. Tuesday, December 22nd. That's at our new site downtown Belleville. Additionally, we have several holiday testing hours that these will all be provided at the St. Clair Fairgrounds. We will be there make sure I have these dates right. We will be at the fairgrounds on Friday, the day after Christmas, December 26th, and then also on December Christmas Eve, December 31st, we'll be at the fairgrounds, and then again on January 2nd, we'll be at the fairgrounds. So that's several testing sites we have available, and with that, I will turn this over to Chairman Kern.
Thank you, Barb. That hospital number of 119, that's the highest I believe it's ever been in St. Clair County.
Oh, boy.
So
Wow.
it's, even though the numbers are down, more people are in the hospital with COVID. So
Yes, they are.
hopefully this vaccine getting out is going to make those numbers improve, because at 119, that's just
That's incredible.
those are records that we don't want to ever reach again. We'll move into the zip code report. These are the changes in COVID positives in these particular St. Clair County zip codes. 62201, we go down 1 today to 442. 62203, up 2 to 483. 62204, up 1 to 311. 62205, up 6 to 479. 62206, up 7 to 933. 62207, up 3 to 435. 62208, up 2 to 1,092. 62220, up 6 to 1,330. 62221, up 5 to 1,801. 62223, up 9 to 1,160. 62226, up 22 today to 2,079. 62232, up 6 to 634. 62239, up 4 to 286. 62243, up 4 to 449. 62254, up 3 to 588. 62257, up 3 to 210. 62258, up 4 to 698. 62260, up 2 to 478. 62264, up 3 to 223. 62269, up 9 to 2,037. And 62285, up 2 to 380. 114 new positives in the county with 1,716 tested brings us to a daily county positivity of 6.6%. That brings our 7-day rolling average to 10.1%. Those numbers continue to look better, but remember, we have a long way to go if we're going to get everything reopened and get the mitigations lifted. But together we can make that happen. Wearing your mask, washing your hands, and watching your social distance. The state pegs our regional positivity today down to 11.7%, and Bond County comes in at 4%, Clinton County 12.4%, Madison 9.2%, Monroe 19.9%, Randolph 16.3%, St. Clair 7.8%, and Washington County clocks in at 28%. So, numbers, Herb, trended a little better this week. Let's see if we can keep that going. I know Team St. Clair is working awfully hard to make this happen. The vaccines coming out this week has been a very, very positive thing.
Very positive, and I think Barb said that there's going to be some more arrival this week, hopefully, that will help get that stockpile that they can't stock for a long time.
So this is Moderna. We're going to get the Moderna vaccine delivered this week.
Yes, we will, and those will be delivered to the hospitals as well. Again, to provide vaccine for those medical providers and the staff at the hospitals, those 1A folks, and then we'll move on and get the EMS folks and the first responders, all those critically important individuals vaccinated first.
And is there a benefit to having both kinds? So people won't be able to choose. They're going to be offered one or the other, and we recommend that whatever you're offered to take.
Right.
The Moderna vaccine, though, stores at a higher temperature, or it's a little easier to handle?
It's a little easier to handle. Pfizer is the one that has to be kept ultra cold, but it really thaws out very quickly. When you put a vial out from there, within 30 minutes, it will thaw out, and you add your additive, and so they're both will be readily available. It's your choice of which one we want to get. Once we get going, we expect to have both offer both types of vaccine, both the Pfizer and the Moderna, when we start the vaccination. Again, one very important thing is make sure that your first and your second vaccination shot is from the same provider, and that it's 21 to 28 days apart. The efficacy on both Pfizer and Moderna is about the same, especially, and this is tested by getting both shots. They're both around 95% efficacy. So it's your choice. There's a lot of information out there. Be sure to, as you review things, that you're getting your information from trusted sources, as well as making your own informed decision about the vaccine.
Have you heard, and it's been out there on the street anecdotally, and I've actually heard it from people who said they've talked to nurses that have been administering the vaccine. Are there more doses in those vials than what they originally thought?
There are, and when the shipments were shipped out, they were based on 5 doses per vial. Well, they've found that there's even a little bit more in there, so as long as they can get the full dosage into the syringe for the individual, they've been finding 6 to 7 possible doses. So we've had more, we're available to vaccinate more, and we for sure don't want to waste any vaccine. So whoever's available that's in those groups, the first responders and those critical folks, the medical providers, we want to get those vaccinations in their arms as soon as possible and not waste any vaccine.
Great, thank you. And so we will be providing those vaccinations at some point at the new St. Clair County Public Service Facility on West Main Street, and that will be announced when that takes place.
Absolutely. Right now, as a matter of fact, as we discussed earlier, we're having our soft opening with COVID testing this Tuesday at the new site. So we want to make sure we're not extending long hours or anything. We want to make sure we get things right. It's brand new. And then the following weeks we'll have more longer hours on a daily basis. But as soon as we get vaccine in, that'll be a priority of what we will be doing at the 330 West Main site to get vaccinations out per those approved groups of what those target populations are as we move forward, getting more vaccine into St. Clair County.
Great. Thank you, Barb.
And today's our question and answer Sunday afternoon that we try to answer the questions that come in. And Brian, you've got some today. Let's go ahead and do them.
Yes, I do. Barb, the questions today are very health department centric. So we'll get started here. The first person asked, a family member is allergic to penicillin and clindamycin. Is the vaccine safe for them?
Again, it's folks that have allergies, please check with your medical provider and ask them if they should receive the vaccination or not. There's reports that some people that are allergic to different vaccinations should really check with their medical provider specifically.
Okay, thank you. The next person says, what happened to the businesses that violated the mitigation orders? The news reported several were cited and some had their licenses pulled. Is that true, and what has happened?
The food sanitation permits were suspended for 7 different facilities that were violating the Tier 3 mitigation orders. They were repeatedly violating the orders. We called them, we gave them information, we issued written citations on several occasions, and they still continued to violate the Tier 3 orders. Again, these were on complaints that we received from the general public that we responded to as the health department. We issued 7 suspension letters and pulled 7 permits from facilities. Again, in the letter, it stated, if you comply with Tier 3 mitigation orders, we'll immediately give you your permit back, which 3 of those facilities did. And so they put it in writing that they would follow their Tier 3 mitigation orders, and they abide by that. Their permits were reinstated. The other 4 have continued to seek a hearing and litigation, and we're in the middle of litigation with those, but as of this time, their permit is still suspended by the health department.
Okay, thank you. The next person says, I have a family member that tested positive for COVID. They will be released from their 10-day quarantine on December 23rd. Is it safe for me to be around them on December 24th?
Well, again, we all need to continue practicing social distancing through the Tier 3 mitigation orders. They really encourage people to only gather with your household members, especially during these holiday times. the individual, as long as they're not symptomatic, showing any symptoms or have any fever, especially as long as they're not taking any fever-reducing medications, they are allowed, they're released from isolation. But again, everyone, if you had COVID or not, you're released from isolation, you're released from quarantine, you still need to wear your mask, you still need to practice social distancing, and ensure you're following those Tier 3 mitigation orders.
Okay. Next person has kind of a two-part question. First part says, has anything been tracked in O'Fallon to determine where our high numbers are coming from? And they follow up by saying, if a person gets both doses of vaccine and then waits 2 weeks, is it safe for them to be around family members and not be considered a carrier?
Yes, again, as we see every day, the numbers in various zip code areas have been very high. We need to ensure people are following those mitigation orders. Our numbers are going down. The mitigation orders have been in place. It works. Wearing the mask, social distancing, washing of the hands, it works. Those are the tools we have. We're getting the vaccine in last week and this week, and we're getting those into the arms. But in the meantime, the second part of this question, as it states, one, you don't have to wait 2 weeks after you get your vaccination. You can be around individuals, again, doing your social distancing. The vaccine is not a live virus. You can't get COVID from getting the vaccine, and you can't give COVID to anyone else because you had the vaccine. However, the COVID virus is in our community everywhere we go, so we still need to continue practicing social distancing and wearing your mask, because even though you may gain your own immunity by getting the vaccination, you can still be a carrier of the virus because it still is in the community. Okay?
Okay. The next person says, can you give some definitive things that might prohibit being able to get the vaccine? I have had several bouts of trigeminal neuralgia and in the past, but have not had a severe one in a number of years. I have heard that Bell's palsy is a possible reaction. They tend to be in the same area, and so I am concerned, especially because of age and not wanting to be any part of neuralgia again.
Very, very good questions and obvious concerns. Again, we highly recommend speaking to your medical provider, your doctor that knows your own personal medical history, whether or not they recommend to get the vaccination. Again, there's a lot of information from CDC and Department of Public Health and Johns Hopkins, all those different sources. Make sure you review and you use information from trusted sources. But again, please check with your medical provider.
Okay, the next person asks, can nurses not working in hospitals but working in the community get a COVID vaccine now?
Absolutely, we're working on that. Again, this first batch is meant for hospitals, medical providers, and those EMS and first responder folks. If you're associated with a hospital, if you're a medical provider associated with a hospital, you would have been counted in that group. As soon as we get that primary group taken care of, because as we said earlier, they're being swamped with patients. So that's our priority group, as well as the critical, the first responders. We will be offering, as soon as the vaccine is available, the county will be offering vaccinations to the 1B group, which includes first responders, nurses, doctors, dentists, hygienists, those folks that are medical providers but aren't associated with the hospital. So we will be giving that information out. As soon as we get that vaccine, we will be letting you know where that vaccination clinic will take place. Again, as I said earlier, the 330 West Main clinic side of the county, we're doing COVID testing right now. As soon as we get the vaccine, we will switch that to a vaccination clinic, and that's a priority.
And Barb, we heard today that some of our area hospitals got to the point where they were able to start treating some of those 1B categories, the police officers, the firemen, other first responders, even some members of Team St. Clair were able to take advantage of this. Because as you mentioned earlier, when there's enough doses, there's only a limited time that they have to be able to get people there to get those doses in the arm before that wouldn't be a valid vaccine anymore.
That is correct. There's a certain time frame that once you set up the vaccine, that you essentially have only so many hours to ensure that that vaccine is administered to the individual. So we had several folks, first responders and Team St. Clair folks that were available right then and there. We needed somebody, and let's vaccinate those folks. We don't want to waste anything. So yes, as any extras that we have, we're going to get it into the arms as fast as we can.
Okay, the next person asks, how long will it take to start seeing numbers go down after giving out the vaccine?
Again, as you can see here, our numbers are going down because it appears we're following those mitigation orders. Depending on how many people actually get vaccinated and continue to follow those mitigation orders, again, we can, even though we're vaccinated, if the virus is in the community, we can continue to spread it. So as long as we make sure we follow the guidelines, and after getting vaccinated, our numbers should be going down, but we still have to make sure we do the social distancing and mask wearing.
Okay, the next person writes, if I currently have COVID, I'm 8 days in, how soon is the vaccine administration recommended? I am a frontline healthcare worker.
Typically, again, once you've had COVID, you would have some immunity, but they recommend, especially for healthcare workers, to go ahead and get your vaccine, your COVID vaccination. The one thing I did see is that if there's others in line and you just had COVID, perhaps your other medical workers may want to be, go ahead and let them go first, and then, but we do highly recommend, and CDC recommends, that you get your vaccine as soon as possible, especially since you're a frontline medical worker.
Okay, the next person wrote, I'm still confused why CDC quarantines an exposed person for 10 days and recommends a test on 5 through 7 days, but Public Health Department quarantines 14 days after last exposure. I do thank all the St. Clair County Health Department and EMA. Personally, I know COVID is rough, not only for the patient, but for all of the family that's affected.
Well, thank you for that, and I will pass that along to staff. Again, at the very beginning, it does sound backwards, but it makes sense. So if you were a positive case, you are to be isolated for 10 days. Because you're already sick, that time frame is a little bit shorter. So 10 days of isolation for positive cases. 14 days for someone that has been exposed, because it may take longer for that virus to affect that individual and make them sick. Historically and typically what we've seen, it's about 5 to 7 days after one's been exposed that you may then develop symptoms. About a month ago, 3 weeks ago, CDC revised their guidelines, and IDPH has just adopted these, that it's still 10 days for isolation. If you're positive, still 10 days for isolation. They have said that you can reduce your quarantine time from 14 days to 10 days, provided you have no symptoms, and that you can reduce that quarantine time. They do have another step in there that you can reduce that quarantine time to 7 days if you have a PCR test that is negative. PCR tests are not the rapid tests in this area. The PCR tests that take a little bit longer. So by the time, even if you would get tested and tested negative, it's probably 10 days. So long and short of that is it's 10 days for isolation, and it can be 10 days of quarantine as long as they do not have symptoms. However, we still strongly encourage quarantine for 14, but they can be released from quarantine within 10 days as long as they have no symptoms.
Okay. The next person says, well, we have a choice of the maker for the shots. I have heard that Moderna is showing better protection.
Again, both of them their efficacy is about 95%. That's after you take both shots. When we will have our clinics, we will let you know which vaccine we have, and at some point in time, we expect to have both available. You have to make sure that the first shot is the same as the second shot, and 21 to 28 days apart. So it can be your choice. Again, we will let you know what vaccinations we will have available at those clinics.
Okay, the next person says, why are the primary care providers of COVID-positive patients not being notified when their patient tests positive. Secondly, they say, why aren't positive patients being asked who they've been in contact with?
Typically, when we get lab reports in, it just has the individual's name. So if you go to our testing sites, the IDPH testing sites, it just has your name. We don't have any information on your medical provider unless you went to their office and had the testing done. So we don't know that information. That's why we provide the information to the individual, and then you can forward that on to your private provider, your medical provider on your own.
And they should be doing that anyway, Barb, because in case they need further treatment or something like that, it's not gonna be the health department doing that or the contact tracer, it's gonna be their primary healthcare provider.
Exactly, and then that can be part of your medical history as
That's
well.
correct.
So yes, very good. Make sure your private provider knows if you've been tested positive and or negative, so that's part of your medical history.
And that's one of the questions that the primary healthcare facility asks you when you go in. Have you tested positive or been around anybody that's tested positive? So, again, it's responsibility of the individual to notify their healthcare provider.
Absolutely, yes.
The next person writes, is it true that a lot of doctors don't do COVID tests on children? A doctor told a friend of mine that since the child only had a fever, they would not test them, especially since they're only 3 years old.
Again, we have, IDPH does have the ability to test children 6 months of age and up because they offer the nasal swab. Southern Illinois Healthcare Foundation test children that are 3 years and up because they use the oral swab. So again, we've had cases of children under 1 year of age that have tested positive for COVID and on up in age-wise. So the testing is available for children through Department of Public Health or Southern Illinois Healthcare Foundation testing clinics.
Okay. The next person says, I'm curious about the number of flu cases this year. I'm hoping that wearing of masks has reduced the number of flu cases as well. Thanks for these daily briefings and the amount of time you spend for the betterment of our county. It is appreciated.
Well, again, thank you for that. The flu cases so far, I mean, there is flu in the community, but it appears so far, knock on wood, not to be as bad. Is that hopefully because folks are wearing their masks, they're washing their hands more, they're being much more sensitive to sanitary conditions, and as well as getting their flu shots, which will also help. So I think all of that combined truly is helping control and not having as much flu in our community so far at this point, and let's hope it stays that way.
And Barb, that's one of the questions that we've been seeing quite frequently on here is the tracking of flu cases. That is not something the health department does, is that correct?
It is not. There are sentinel sites that keep track of flu cases. We don't necessarily have tracking of how many flu shots have been distributed because they're available through so many different communities and pharmacies and so forth. But the actual flu cases of what we've seen, as a general rule, seem to be at this point in time a little less.
Very good.
Okay. The next person says, kind of a follow-up to an earlier question, still seeing several restaurants opened even after they were told they had to close. I don't think they got through all 4 steps again before getting shut down. It's obvious to us they don't care.
Again, if you have facilities that are not following the Tier 3 mitigation rules, please let us know, or please let your local mayor, your local law enforcement within that municipality, let them know, because we got to follow these Tier 3 mitigation orders. We have to do the social distancing, and no indoor dining is allowed, and it has been a proven fact that helps control the spread of COVID. So please contact those local authorities or the health department and advise them of what facilities are continuing to violate these rules.
Okay. The next person says, why is St. Clair County enforcing the mitigations, but Clinton County is not? 3 restaurants in New Baden still have in-service dining. It should be the same throughout the area.
Well, again, the governor's Tier 3 mitigation does cover all of the state of Illinois. It is left up to the locals to help enforce that. State police can, but again, the mayors, the liquor commissioners for that area, the local law enforcement, and the local health department all are the regulatory authority to help enforce those Tier 3 mitigation rules. Again, we're trying to do everything we can in St. Clair County to help control the spread of this virus. I would suggest calling those local officials in those counties that continue to violate the orders, and we all need to be in this to work together. The virus doesn't stop at county lines. We all need to ensure that we're following the rules and continue to battle this deadly disease.
Okay. And the final person here wrote, not a question, just more of an observation, that stores in Fairview were not complying with the orders yesterday. The parking lots were full at Kohl's and all the other stores in that complex. I did see police driving around, but they did not go into the stores. I'm concerned numbers will be going up with this type of behavior.
And we are concerned with that too as well. With the mitigation orders, retail stores are supposed to be at 25% of capacity. Grocery stores can be at 50% of the capacity. Again, people wearing their mask and social distancing is critical. The holidays are coming up. I know everyone wants to see their family and loved ones, and it's been a long, 9 months or 282 days that we haven't got to do what we want to do. And Christmas is a very special time of year for all of us, but we need to continue to work to get through this. We hope we don't see a surge 2 or 3 weeks after the Christmas holidays from everyone gathering. So again, continue to fight a good fight. We're getting there, folks, and we got a light at the end of the tunnel. Let's keep it up.
Very good. That's the question and answers, and that's a good way to end it, Barb. I think with the holiday season up here on us, and it has been a long 9 months, as we all know, just as well as all of Team St. Clair has. But the one thing that everybody needs to remember, we've come 282 days of fighting this invisible enemy. The vaccine is here in the county. You've heard the new site going to open up here this week, a testing site, and then a vaccination site that the county's doing. A lot of work has been done on this around the clock for 282 days. The one thing that we all need to remember, yes, the times have been tough. We may have not been able to spend that Thanksgiving as we normally have. We may not be able to spend Christmas the way we had, or New Year's. But I assure you, if we don't continue to do what we've been preaching for 282 days, some of us may not be able to ever enjoy those holidays again. As I said this week, the best gift you can give anybody is not to give them the COVID, because if you get it, our hospitalizations here in the county went up 11 overnight. We've got to work on that. So please, as you heard Barb say, and that's coming from our health department, the St. Clair County Health Department, Eastside Health District, all of these health departments are working to try to do the best they can for each and every one of us. So please, let's continue to do our part and be a part of that solution, and we can get through this. We're getting closer. We'll be back with Daisy in a few moments to translate this into our Spanish communities, and then we'll be back tomorrow with more numbers. Have a good evening.
On behalf of the O'Fallon, Shiloh, and Greater Belleville Chambers of Commerce, we ask you to wear your mask, wash your hands, and watch your distance. By doing these 3 simple things, you will be supporting our businesses, all who have had a difficult year, and they need your support now more than ever. The business community understands the risk to our customers, and we want to present them with the safest environment possible. Whether you are able to shop in store, order online, dine outside, order to go, or call for curbside pickup, it is time we all come together. Together, we will stand strong.
Buenas tardes y gracias por acompañarnos una tarde más. Barb Holt estuvo con nosotros hoy anunciando los números del condado y del estado. Estamos a 193,413 exámenes que se han conducido. Este es un incremento de 1,716 del día de ayer y 19,162 casos positivos, que incluye 114 nuevos casos de hombres y mujeres en las edades de menos de 10 años a 90 años. 174,251 exámenes negativos y 297 muertes, que tristemente incluye 2 nuevas muertes de un hombre de 70 años y un hombre de 80, los dos que no se reconocían problemas de salud previos. 17,051 es el número de personas que obtuvieron un resultado positivo y que han completado los 10 días de aislamiento requeridos por el Departamento de Salud. Los números estatales son de 12,434,525 exámenes que se han conducido y 900,370 casos positivos, que incluye un incremento de 6,003 nuevos casos en el estado y 15,202 muertes, que tristemente incluye 79 nuevas muertes en el estado. Hasta el día hay 119 pacientes hospitalizados por problemas relacionados con COVID-19 en el condado y 13 de ellos se encuentran en ventiladores. En la región hay 209 hospitalizados y 20 de ellos se encuentran en ventiladores. Hoy solo le reportamos 3 cambios en las instalaciones de cuidado a largo plazo, que son en Four Fountains, que aumentó con 2 casos, Mercy Rehab and Care Center de Swansea, que aumentó con 10 casos, y St. Paul's Home, que aumentó con 1 caso. Mark Kern, el director del condado, estuvo con nosotros hoy anunciando los números de casos por código postal, y hoy solo le voy a mencionar los que tuvieron un incremento. 62203 aumentó con 2 casos, 62204 aumentó con 1 caso, 62205 aumentó con 6 casos, 62206 aumentó con 7 casos, 62207 aumentó con 3 casos, 62208 aumentó con 2 casos, 62220 aumentó con 6 casos, 62221 aumentó con 5 casos, 62223 aumentó con 9 casos, 62226 aumentó con 22 casos, 62232 aumentó con 6 casos, 62239 aumentó con 4 casos, 62243 aumentó con 4 casos, 62254 aumentó con 3 casos, 62257 aumentó con 3 casos, 62258 aumentó con 4 casos, 62260 aumentó con 2 casos, 62264 aumentó con 3 casos, 62269 aumentó con 9 casos y 62285 aumentó con 2 casos. Hoy tuvimos la sesión de preguntas y respuestas y hoy solo voy a mencionar 2 de las preguntas que se hicieron. La primera es: si tengo un familiar que salió positivo de COVID y saldrá de cuarentena el 23 de diciembre, ¿será buena idea juntarnos con él esta Navidad? Se recomienda que solo se conviva con las personas que viven en su casa. Segunda pregunta es: ¿hay ciertas alergias o enfermedades que puede prohibir a una persona que reciba la vacuna contra el COVID? Esa pregunta será mejor hacérsela a su doctor, ya que ellos lo pueden orientar mucho mejor sobre su salud y conocen su historial médico. Y finalmente, Herb Simmons estuvo con nosotros hoy y nos comentó que estamos a 6.6% de casos positivos en el condado y a 11.7% de casos positivos en la región. Muchas gracias y nos vemos mañana.